So I'm Derick Raal. I'm an endocrinologist from Johannesburg, South Africa, and I'm presently at the EAS meeting in Maastricht. And I've just presented at one of the late-breaking sessions the efficacy of a drug called inclisiran in patients with homozygous familial hypercholesterolemia. This was called the ORION-2 study. Now, we are aware that the monoclonal antibodies, evolocumab and alirocumab, are effective in homozygous FH and on average reduce LDL cholesterol by about 30%. But the problem with monoclonal antibodies, they're mopping up PCSK9, so they have to be given fortnightly to maintain the reduction. Now, inclisiran is a new drug which acts by inhibiting the production of PCSK9 by the liver. It's a small interfering RNA, so it's turning off the tap rather than clearing PCSK9 from the secretion. We do know it's very effective in patients with hypercholesterolemia, but the big question was, would it also work in patients with homozygous familial hypercholesterolemia? So this was just a small proof of concept study. We just enrolled 4 patients with genetically proven homozygous familial hypercholesterolemia. The drug was administered at day 1 and then again at day 90, and the patients were followed out to day 180. Now, 3 of the 4 patients responded to inclisiran with a reduction of up to 30% in LDL cholesterol levels, which is very similar to what we've seen in patients receiving the monoclonal antibody. So I think the message from this study was, with a medication that's given much less frequently, only at the beginning and then at 90 days and then every 6 months, we can get a similar reduction in LDL cholesterol as is seen with the monoclonal antibodies. The effect, however, is very persistent. So right out to day 180, there was a persistent reduction in LDL cholesterol. So inclisiran is another drug that's found to have efficacy in these difficult to treat patients with homozygous familial hypercholesterolemia. And it's resulted in now the ORION-5 studies, which is a bigger outcome study looking at about 45 patients with homozygous FH, just to confirm that this effect does occur in these difficult to treat patients. Just one corollary is that patients have to have some LDL receptor function. So the 4 patients that were enrolled into the study all had what we call defective homozygous FH. They did have some residual LDL receptor function. We've seen with the monoclonal antibodies is that if there's no LDL receptor function at all, what we call null receptor mutations in the LDL receptor, these drugs, PCSK9 inhibitors, are not effective in this patient group.